a lot of the talks and a lot of the newspaper articles and literature that's going around about the CDC guidelines really focus on the outpatient problems with chronic pain patients, but there is a growing trend of concern looking at how we prescribe opioids for post-op pain control. And so there is a fair amount of literature that's beginning to creep into in the limelight about whether or not the way we prescribe opioids post-operatively is contributing to the problem. And it does appear that it is a big concern, especially in light of everything that's going on in the country right now. The first thing to get across is that opioids are not the only way of controlling pain. And we usually use what we call multimodal analgesia. You can call it rational pharmacotherapy if you want, but we use a wide variety of other medications, adjuvant medications, gabapentin, acetaminophen, to try to reduce the amount of opioids that patients need post-operatively. We also use a wide variety of interventional techniques if they need an epidural or if they need a peripheral nerve block to help with their pain control. We even send some patients home with these peripheral nerve blocks, catheters that can help control their pain for as long as a week, or if they need it. And of course, that being said, we try to minimize the opioid burden, and then there needs to be an exit strategy. So a lot of times patients get lost in the shuffle between surgeons and primary care physicians, and they're left on opioids even a year out from their surgery. And so we need to be cognizant of that and make sure that they have some sort of an exit strategy. Patients who are at high risk of developing persistent opioid use after surgery are people who are young, what we deem as catastrophizing behavior, high anxiety, depression. If they have high pain levels before their surgery, or if they're already taking opioids before surgery at even minimal doses, they're at high risk of developing persistent use afterwards. So those types of patients we like to identify before they get to surgery, develop a plan with the patients, have these conversations about their expectations and what we're going to try to achieve, and then develop that multimodal, multidisciplinary approach to taking care of their pain post-operatively.